Hi, it's the nursing professor, and today we want to talk about drug calculations. The math that's required for nursing school sometimes scares people off. And even once they're in nursing school, it becomes a source of great fear. So we want to try and show you how you will do these calculations and to also lessen the fear around it. Because again, you're going to do this for the rest of your career as a nurse. So it's good that you know how to do it and you become comfortable with it. So the first one I want to give to you is D over H times Q. That is a Q. That looks a little weird now. But this basically means dose ordered. That's how it's ordered over H, what you have in hand. So the dose has to be ordered in whatever units you have. So if the doctor orders 50 milligrams, your medication needs to be in milligrams. It should not be he's ordering 20 units and you have a milligram type pill. Then that means something's wrong there and you need to question the order. So it's going to be dose ordered over what you have on hand times quantity. Quantity is, so this right here, we're using my generic diphenhydramine, which is otherwise known as Benadryl. This says 25 milligrams in each tablet. I don't know if you can see that without it getting blurry. So the quantity would be times quantity would be one tablet in this case. So for example, let's pretend that the doctor ordered 50 milligrams of diphenhydramine. On hand, I have 25 milligrams times one tablet, okay? Because I just showed you the label and it shows that in each tablet they have 25 milligrams. So this you would do as a simple division problem, 25 into 50, and that goes 2 times 25 is 50. So the answer is 2 tablets. You must answer in the quantity that it is ordered in. So it's 2 tablets. You can't just say the answer is 2 because 2 what? And that's a way of making sure that you keep what's ordered with what you have on hand. So you don't want to mix up, 50 units is not equal to 50 milligrams. So this is what you primarily use for pills. Also for IM injections, you will also see the same thing. Then the units would change. It might say 50, it might say 50 milligrams is still 25 milligrams, but it would be 25 milligrams per milliliter because see, we're talking about liquid. So D over H times Q is what you're going to use a lot. The other one would be calculating IV drip rate. Now you might ask, why would I need to calculate an IV drip rate because we have pumps? Well, again, you are the last stop before you give anything to the patient. So you need to know how to do it. One, to get out of your nursing dosage class, to pass the boards, and to be able to check your work. Not all the time will you have a pump or will you have technology to always help you with the things that you need to know how to do. So you need to know this. So the equation to remember here is total volume, that's TV, over time. The time always has to be in minutes, times the drip factor. This is the drops per milliliter. And you will learn all of these things that we use, like GTT is for drops. So let's say that the doctor ordered 1,000 milliliters of saline to go over 6 hours. So 60 minutes times 6 is 360 minutes. Because remember, we said the time always has to be in minutes. And let's say that the IV drip rate we saw on our tubing in this institution is 10 drops per milliliter. So this again is a division. So we're going to do 360, just making sure you can see me, into 1,000. And this is going to be 360 goes into 1,000 2 times. And 2 times 360 is 720. So we're going to minus this right here, and we're going to end up with 280. And at this point, we have to do our decimal point because we have now exhausted. We always have to keep our columns true. So how many times does 360 go into? Now we're going to create another 0 because we need to now make sure that we are able to pull this out further to make sure if we have to round or not. So 360 goes into 2,800 7 times. Yeah, 7 times 360 is going to be 2520. And then this is going to be, once again, another 280. So as you see, this is going to keep going if we kept doing this. So it's going to be 2.7777. So in this case, you could round up to 2.8. So this would be, let's just keep it at 2.7. So 2.7 times 10 is going to equal 27. So that means there has to be 27 drops per minute in order to get this whole 1,000 milliliter bag into the patient in 6 hours. So there you are. I did a problem for you with the IV drip rate and the D over H times Q. I hope that helps to make it a little easier for you. Hey, it's the nursing professor, and now that you've reviewed how to do calculation problems, I'm going to give you a problem and you let me know what your answer is. So we have a child who finds it hard to swallow pills. So the doctor has ordered Tylenol 500 milligrams by mouth every 4 hours as needed for pain. Your bottle of Tylenol says you have children's Tylenol 160 milligrams per 5 milliliters. So this is the strength that you have on hand. So this is the drug, and this is what you have on hand. And this is the quantity. So you have 160 milligrams in 5 milliliters. Set this up and let me know how many milliliters will you give.